We were both at the World Series game. I was game 3, he was at game 4. We were just kind of coming and going. Dr. Michael Papagikos here is talking about November's National Lung Cancer Awareness Month. It's just a devastating disease. 150, now is that being kind? 150,000 people?
So 200,000 people in the U.S. are diagnosed each year, and 150,000 people die each year out of that 200,000. And it is by far the #1 cause of cancer death amongst men and women. If you add up the number of people who die from prostate cancer, breast cancer, and colon cancer, it still doesn't equal the number of people that die from lung cancer.
And I always feel bad when I say things like this, but if there's a silver lining to lung cancer, and it's hard finding one, it's got to be one of the most preventable cancers out there.
That's one of the frustrating things about it. It is easily the most preventable cancer. 90% of all lung cancers are directly attributable to smoking. So, you know, quitting smoking is hard, not starting smoking is hard, but if we could kind of tackle that behavioral modification, we would see the mortality rate just plummet. And unfortunately, it doesn't impact just smokers. There's 10,000 people that die per year that are never smokers, that are just the results of secondhand exposure. So fortunately, we're making lots of strides in smoking cessation. We're seeing smoking, new smoker rates are starting to decline, but there's still a lot of people out there that are either still smoking or have recently quit that are going to be at risk for lung cancer for the foreseeable future.
And one of the great things you have now at New Hanover Regional Medical Center, the lung program there, so people, if they are affected by this disease, they no longer have to go to Chapel Hill to do, you can do things right here now.
Yeah, we're really excited about this new program. And so what the lung program is, it's a multidisciplinary clinic. And so we want most lung cancer patients at some point in the process to see a surgeon, to see a medical oncologist that specializes in chemotherapy, and a radiation oncologist that specializes in radiation. And that's what I do. And historically, that would sometimes take a while to get all of those appointments lined up, and each doctor then wants to order their own specific scans. And now we've kind of consolidated all of that. And so we just had our first clinic yesterday. And so patients can come to New Hanover Regional Medical Center, and it's the first and third Wednesday of every month. And they come to one place, and they're seen by a surgeon, by myself, by a medical oncologist. We have pulmonary medicine involved, social workers, nutritionists. We can talk about clinical studies, and it's really kind of a one-stop shopping to get all of that really important stuff done. And they get set up with a patient care navigator who's a nurse whose sole job it is to kind of hold that patient's hand through that whole process. And the expectation is that it's going to really shrink the amount of time that goes by from that first abnormal chest X-ray to getting the staging, completed, and to getting them on their course of treatment. And so by keeping that treatment small, we hope to improve outcomes.
And again, it's great that that right now is right here in our own backyard. So if it's something that you're dealing with, again, you don't have to do that trip anywhere else. You've got it right here in New Hanover County.
It's great.
I apologize for the World Series win.
Go Royals.
We're back with more after this.